Hi guys, in today's histology part 2, we are going to talk about epithelial tissue. So, epithelial tissue, first of all, is of two types. One is simple epithelium and second is stratified epithelium. So, as you can see here, simple epithelium is of single layer. These are always of single layer. And the stratified epithelium are made up of multiple layer. You can see here, multiple layers. And the simple epithelium is single layer. So first, let's talk about simple epithelium. First, let's talk about simple epithelium. So in simple epithelium, what is squamous? You can see here simple squamous. So how do you know that these are squamous? So in squamous epithelium, squamous are flat cells with flat nuclei. You can see here, you can see here, these are flat. These simple squamous, these are flat cells. And these, you can see here their nucleus, it is also flat. So what is next type? That is simple cuboidal. Simple cuboidal. So in simple cuboidal, height is equal to breadth. You can see here, actually it is of square shaped, and in this height is equal to breadth with central spherical nucleus. Their nucleus is spherical. You can see here, nucleus is spherical. So they have spherical nucleus. Okay. And now next, that is columnar. So what is different in columnar? What is different in columnar? In columnar, height is more than breadth, and their nucleus, you can see here, their nucleus is oval shaped. Height is more than breadth. You can see here in diagram, height is more than breadth, and nucleus is oval based nucleus. Nucleus is oval base nucleus. Okay. So actually these squamous, cuboidal and columnar have also one more difference, which is very important, that they are different in secretion. And this I am going to tell you with an example. So do you know that in our thyroid, these all three can be present? How? Actually, it depends on the secretion of thyroid. So when the thyroid follicle lines depends on the amount of thyroxine secretion. When the secretion is when the secretion is low, then, or you can say scanty, or you can say scanty, then it is squamous. Then it is squamous. When secretion is medium, when secretion is medium, then it is cuboidal. And when the secretion is high, then it is columnar. Did you understand that in thyroid, these three are present, can be present? That squamous can also be present, cuboidal can also be present, and columnar can be also be present. But how? Like when the secretion is low, or you can say scanty, so the squamous is present. When the secretion in thyroid secretion is medium, then it is cuboidal. And when the thyroid secretion is high, when the thyroid secretion is high, then it is columnar. So the thyroid follicle lines depends on the amount of thyroxine secretion. Let's understand with a diagram. So here you can see a flat shaped. What it will be? It will be simple squamous, simple squamous, and if it isn't thyroid, then it is also called like in resting follicle. Resting follicle. The thyroid are in resting follicle because the secretion is very low. The secretion is very low. And what about its nucleus? What about its nucleus? Nucleus is flat cell. Is it always flat nucleus? No. Sometimes it is globular also. Sometimes it is globular also. It is globular also. Let, let's move to next one. That is cuboidal. So in cuboidal, I told you height is equals to breadth. And what else? Nucleus. How is it nucleus? It is central spherical. It is central spherical. What will be its secretion? Or you can say follicle. We will say it as normal follicle. So normal follicle. And the last one, that is columnar with oval base nucleus with oval base nucleus. So I want to tell you one more thing here, that in this, what are these? These are endoplasmic reticulum. Endoplasmic reticulum. In columnar, endoplasmic reticulum is high. But why? Why endoplasmic reticulum higher? Because of more thyroid follicles. Because of more thyroid follicle. Or you can say more active thyroid follicle. More active thyroid follicle. Due to which more thyroxine is produced. Simple. Endoplasmic reticulum is more because of more thyroxine. If we want more thyroxine, then what we want? We want more endoplasmic reticulum. Simple. So let's differentiate between them. So here is the thing. As we all seen in thyroid, first let's complete that in simple squamous, resting thyroid follicle. Now these are the location, like where are these epithelium are found. Epithelium are found. We will differentiate them, that where are they found from their locations. So of course, first we will talk about their thyroid one. So in simple, these are found in resting follicles. Resting follicle. In simple cuboidal, where then again medium, you can say medium thyroid follicle. And what last? Simple columnar, that is active thyroid follicle. So what are the other places that these epithelium are found? So let's first talk about simple squamous epithelium. In simple squamous, these are also found in mesothelium. Do you remember mesothelium? I told you in last lecture. And what are these type? That is peritoneum. Peritoneum. That means these are found in serosa. These are found in serosa. And what are the other types of mesothelium? That is pleura. And what else? Pericardium. At these places, simple squamous is found. Now, what about simple cuboidal? Where these are found? No, let's talk this with a diagram. So here you can see that simple cuboidal is found in kidney. So where in kidney? Do you know? In kidney, they are found in PCT and DCT. So how do you know that these are simple cuboidal again? Here, can you see that these are spherical nucleus and their h equals to b, that is height equals to breadth. These are cuboidal. Here you can see cuboidal with central spherical nucleus. Here you can see cuboidal with central spherical nucleus. Now let's talk about the last one, that is simple columnar. So where these are found, except the thyroid one, these are found in small intestine. Here, small intestine. And where else? And where else? That is stomach. That is stomach. Let's talk it with a diagram. So guys, here can you see simple columnar epithelium. As I told you that they have is in small intestine, cilia is there. Why cilia is there? For the more absorption. So one more thing here, that in small, here you can see that cilia are in equal and they are running parallel to each other. So what does that mean? So what does that mean? That these are striated. So in small intestine, we will take it as striated. Simple columnar is striated. What else? Here you can see that how it is columnar. Height is more than the breadth. Here you can see height is more than the breadth. And what else? As usual, oval base nucleus. Oval base nucleus. So this is what about I told you about the small intestine. There is a rule in stratified squamous epithelium. What is that rule? That the rule is that all the external openings, that all the external openings are lined by squamous epithelia. That all the external openings that are lined by stratified squamous epithelium. It is very important. Okay. So how we are going to differentiate between the squamous, cuboidal, and the columnar in striated? Here we will see it in a diagram. So here you can see that the layers in the superficial layer, the superficial layer is squamous, is squamous. These are the types that how we decide their name. You can see here that the superficial cells, that these superficial cells, these are flat and their nucleus is also flat, so these are squamous. And what the middle layer? Here you can see the middle layer. What are these? You can see that they have central spherical nucleus. And what else? That height is equal to breadth. So what it will be? It will be cuboidal. And here you can see height is more than the breadth. That means basal layer. Basal layer is columnar. Basal layer is columnar. So where are these stratified squamous epithelium are found? I told you all the external openings. So what are the openings in the body? What are the opening in the body? So first there is oral cavity, second there is nasal cavity, third there is eyes, eyes, and then ears also. It is also, and then our our perineum layer, and what in perineal layer comes? That is urethra, and what else? Vagina, and what else? That is anal canal. Okay. So one more thing that is very important, I have to tell you, very important thing, that in epiglottis, do you know that in epiglottis have two types of layer? No, two types of epithelium, you can say. Epiglottis, epiglottis have two types of epithelium because it has two surfaces. What are the two surfaces? One is lingual surface. One is lingual surface, or what is lingual surface? Lingual surface is actually is oral surface. That is oral surface, and the other one, that is laryngeal surface. Laryngeal surface, or you can say that laryngeal surface is actually where the respiratory epithelium is found. Where the respiratory epithelium is found. So I made it very simple for you that in oral cavity, I told you like so many times that which epithelium is found. That oral surface is lined by which epithelium? I told you in previous lecture also, right now also, that it is stratified. Stratified squamous. All right. And respiratory also, I told you in last lecture. Did you know? That is pseudo stratified. Ciliated. Why cilia? I told you in last lecture, to move mucus and clear the passage. Pseudo stratified ciliated columnar in epithelium. So let's talk about this. What is this? I told you about that stratified squamous, but what is pseudo stratified ciliated columnar? What is pseudo stratified ciliated columnar? So here I will tell you about this. So we will see it in a diagram. So here is it is, that is cilia is present. Cilia is present. Why cilia is present? To clear the passage. To clear passage. And what else? A very important, like what is pseudo stratified? What does pseudo stratified mean? It means that these are stratified, but we cannot say that these are properly stratified. That why? I will tell you why. Because each cell, each cell is touching the basement membrane. That is why it is pseudo stratified. Like multiple layers are present, but each cell, here you can see that each cell here See in the diagram that each cell is able to touch the basement membrane. This is basement membrane. This is basement, and each cell is able to touch the basement membrane. It is why called pseudostratified. And where it is found? It is found in respiratory epithelium. It is found in respiratory epithelium. So let's talk about the next one, that is transitional transitional epithelium. We will take a diagram first. So first of all, where the transitional epithelium is found. These are found in our urothelium, you can say. So we will take it as an example. So what is about transitional epithelium different? What is difference in transitional epithelium? The difference is that the cell towards the lumen are quite larger and umbrella shaped. Here you can see these are umbrella shaped. You can say umbrella shaped. And what is the second feature of this? First is that the cells towards lumen are umbrella shaped. Umbrella shaped. What else? Second, these are stretchable. These are stretchable epithelium. Transitional epithelium is stretchable. Why stretchable? Why stretchable? Because when the urine is collected in the urinary bladder, it stretches. It here you can see it is stretches. Like when they are loose, they are up to like about 5 to 6 layer or 7 layers. But when it is stretched, it becomes 2 to 3 layer. And when it is loose, it becomes 5 to 6. When the organ wall contracts, the epithelium is unstretched and consists of many layers. I told you 5 to 6 layers when it is unstretched, and when the organ is stretched, and when the organ is distended and the tissue is stretched, it appears thinner. I told you 2 to 3 layers. Okay. And what else? What is the third one? Here also, like pseudo satisfied, uh, transitional epithelium also transitional epithelium also, all the cells of transitional epithelium attaches the attaches the basement membrane. Here also, same as pseudostratified, transitional cells also attaches the basement membrane. So let's take again the difference. Let's revise it. The difference between transitional epithelium, stratified squamous epithelium, and pseudo-stratified epithelium. So in transitional, cell towards the lumen are umbrella shaped. Are umbrella shaped, or you can say globular towards the surface. These are globular towards the surface. Now, what about stratified squamous? What about stratified squamous? That they have what type of cells? I told you on the superficial layer. Which shape? That flat cell. Flat. As I told you, flat cell towards the surface. and at the middle there will be cuboidal, and at the basement membrane there will be columnar. There will be columnar. And at last, which one? Pseudo, pseudo stratified epithelium with cilia. Where they are found? They are found at respiratory epithelium. They are found at respiratory epithelium. So here was the difference. Now again, we will talk about stratified, stratified squamous epithelium. Let's talk about it. So there was a rule. Do you remember that I told you that all the external openings are lined by, what are they lined by? They are lined by stratified squamous epithelium. Okay, but I want to tell you that there is a embryology rule. That what does we say in embryology? What does we say in embryology? All the external all the external openings all the external openings are lined by that all the external openings of body is always always lined by surface ectoderm. That is surface ectoderm. And do you know that the surface ectoderm, that the ectoderm, that the stratified squamous epithelium is present on the ectoderm, that the stratified squamous epithelium, the stratified squamous epithelium covers the ectoderm. Does it only covers the ectoderm? No. Do you know that the stratified, the stratified squamous epithelium can also present on can also present on can also present on mesoderm, and where else? Endoderm. Endoderm. We will talk it. Let's talk with an example, that is vagina. We all know that vagina epithelium is of which? That is stratified squamous epithelium. We all know that. But do you know that the upper vagina is derived from that the upper vagina is derived from mesoderm, and the lower vagina is derived from endoderm. So here is the proof that the stratified squamous epithelium can also be present on mesoderm and endoderm. So this was the proof. But let's talk about some exception also. I told you that stratified squamous epithelium are only present on external openings. But here is an exception. Here is an exception. So what is the exception? That stratified squamous epithelium, stratified squamous epithelium is also rarely rarely can be found on internal opening. I told you that these are only found in external opening, but there is a place where there can be found in internal opening also. Which is the place? That is vocal cords. At vocal cords, stratified squamous epithelium is found. So why? Like what? First of all, tell me that what is the function of stratified squamous epithelium? What is function? Its function is protection. And why vocal cord needs protection? Actually, stratified squamous epithelium protects from abrasion. So how abrasion can occur in vocal cords? Actually, when we sneeze or when we cough, large amount of uh, air passes, due to which abrasions can occur. Due to which abrasions can occur on the vocal cord. So, from to protect this, squamous, certified squamous epithelium is needed for the protection. So again, let's talk about the those seven openings now in details. That in those openings where these are present, like stratified squamous epithelium are present on seven openings. Seven openings. There are total seven external openings in our body. First one is eyes. First one is eyes. So in eyes, where it is found? I want that it these are I want to tell you that these are found in first layer of cornea. These are found in first layer of cornea. That the first layer of cornea is made up of satisfied squamous epithelium. Where which is the will be the second opening. The second opening is ears. So here is one thing very important that I want to tell you. Suppose this is ear. This is external ear and that is internal ear. So the stratified squamous is found in this area, not in the middle and the internal ear. These are found in the external ear. You can say on external ear canal. These are found on the external ear canal. External canal, or where else? This at this surface. What is this? This is tim this is tympanic membrane. Tympanic membrane. So, does tympanic membrane is made up of stratified squamous epithelium? Yes, but actually, like epiglottis, tympanic membrane has two surfaces, that is outer surface and inner surface. At the outer surface, this surface, like the outer surface of the tympanic membrane, outer surface of tympanic membrane is made up of, is covered by which epithelium? That is stratified squamous epithelium. All right, and the external ear canal. Then what is the middle ear cavity and the inner surface of tympanic membrane is covered by? Which epithelium? Which epithelium is found in middle ear plus tympanic membrane, inner ear canal, okay, or you can say inner surface. Which epithelium? The epithelium is stratified cuboidal epithelium. Cuboidal epithelium. So, at the middle ear and the tympanic membrane of inner surface, stratified cuboidal epithelium is found. Third opening, which is the third opening? That is nose. Like in nose, vestibule is there. Vestibule. What is vestibule? That is skin with hair. Hairs are present in our nose, right? So vestibule in the inner, okay. So inner nose, vestibulate skin with hair, that is stratified squamous epithelium is present. Now we will talk about oral cavity, but in oral cavity again, it is not so simple like nose that we will directly say that nose has stratified squamous epithelium because skin with hair are present in vestibule. That is, in oral cavity, we will take two different types. That is, one is tongue or hard palate, hard palate. But hard palate's outer surface. I'm talking about outer surface and hard. So which type of satisfied squamous epithelium is found? Actually, in this, I told you that the on the inner tongue, uh, keratinized stratified squamous epithelium is found. That in the previous lecture I told you. But on the outer surface, ortho, or you can say parakeratinized, keratinized satisfied squamous epithelium is found. And on the on the other, which is in the other, that is tonsil, epiglottis. Again, I am talking about epiglottis lingual surface, not the laryngeal surface. Understand? Yes, the oral surface, or you can say lingual surface. Which type of stratified squamous epithelium is found? That is non-keratinized. Non-keratinized squamous epithelium. Stratified squamous epithelium is found. Now again, what is the difference between the keratinized and the parakeratinized? The difference between keratinized and parakeratinized. What will be its difference? First of all, that these are found on skin and these are seen in tongue, and you can say hard palate. Again, the outer surface, don't forget outer surface. The inner surface is keratinized. I told you that. All right. So, what is the difference? I told you in previous lecture that superficial layer, the superficial layer have no nuclei. I told you this in a previous lecture. And in parakeratinized, superficial layer have nuclei. Let us superficial layer have nuclei. Simple. All right. Now, one more thing that I want to tell you about ears. In ear, do you know that glands are also present In stratified squamous epithelium, we know that sweat gland is present in skin, but in skin of ear, a wax gland is present. Wax gland is present. Do you know wax gland? And what we called it as? We called it as ceruminous gland. We, what? Ceruminous gland. Ceruminous gland. Okay. And what type of gland is it is? So actually, it is modified. It is modified apocrine sweat gland. All right. Okay. So we have talked about the four openings, that is eyes, ears, nose, and oral cavity. Let's talk about the opening in the perineum. Opening in the perineum. Opening in the perineum. So, what are the three openings? We both we all know that there are three openings. First one is urethra. Second one is vagina, and the last one is anus. That is anal canal. So we will take this. All right. So let's first talk about let's first talk about urethra. So first I'm going to talk about that female urethra. We all know that female urethra is only of 4 centimeter, so it is lined by stratified squamous epithelium. But in male urethra, we all know that male urethra is longer than female urethra, that is 20 centimeters. So in this, only the tip is lined. The tip is lined by stratified squamous epithelium. What else? The other part, the other part of urethra is lined by stratified columnar, stratified columnar epithelium. So remember this. Understand? In the sixth opening, let's talk about the sixth opening, that is vagina, that is vagina, that this is urethra, vagina, and we all know that there is no need to discuss it. That is made up of stratified squamous epithelium. No point to discuss it. Let's talk, move on the last and the seventh opening, that is anal canal. Now in this anal canal is a difference that in anal canal only the part which is below dentate. We all know that what is below dentate, but you can say we can also call it as pectinate line. The pectinate line or the below dentate part of anal canal is only made up of stratified squamous epithelium. All right. So here we discussed the seven openings of this, the seven openings, external openings. Now, let me tell you a very important, which will help you in, especially in medical career, like when you will see your patient, how you can save a patient's life. So, I want to tell you, so guys, I want to tell you a very important thing that in our body there is junction, that is squamocolumnar junction. I will tell you that what is this squamocolumnar junction, but this junction is very prone. to metaplasia. Now, what does this prone to metaplasia means? That is, it can cause dysplasia. And what does this means? That it can cause cancer. It can cause cancer. And where it is present? It is present at anal canal. Anal canal. And where? That is, where else? Esophagus. And where this can happen? The last one. That is uterine part. The uterine, or you can say cervix. So here, let's talk about the esophagus one, because this comes in exams the most, and you can say the very, you can say it is a very hot topic. Condition where the in this esophagus, this condition happens in esophagus, that is called Barrett's esophagus. So let's understand this with a diagram. So here, uh, take it as this is like oral cavity, and if this is oral cavity, what will be followed by? It will be followed by pharynx, and then the the esophagus, and then the stomach. And what will be stomach will followed by? It will be followed by small intestine, that is, or you can say duodenum. Duodenum. So here's the thing, that at this point here, let me show you with another color, that here, this, what is this point? This point is JEG. What is JE? Sorry, JEJ. So, what is JEJ? JEJ is JEJ is gastroesophageal junction. What it is? It is gastroesophageal junction. Like you must have understand, that is a junction where the esophagus and the stomach meet. Okay, and this is stomach. And now, like, what is Barrett's esophagus? Actually, in Barrett esophagus, so when a patients come to you, and you can say the acid reflux is there in his body, that the acid is coming out from stomach to esophagus. So how it can affect, or how it can create a chance of very dangerous situation, that is cancer. So let me tell you. First of all, we all know that layer of oral cavity, it is made up of, that is squamous epithelium. All right, squamous epithelium, and the layer of duodenum, or you can say small intestine, and the stomach is made up of columnar, that is columnar epithelium. All right. So where these lines meet at this point, and what is this point is called? It is Z line. It is Z line. The point where the line epithelium of oral cavity, it is squamous epithelium, and the line of small intestine and stomach, that is columnar epithelium meet. That is the Z line. So actually, what happens when the acid reflux, that the acid reflux is there, when the acid reflux is there, it burns the lining, that it burns the lining of esophagus. esophagus. And what is esophagus made up of? It is made up of stratified squamous epithelium. But because it burns, it converts into like the stratified squamous epithelium. The stratified squamous epithelium converts into columnar epithelium. Columnar epithelium. Due to which, due to which Z line, which was here, you can see this was Z line. This was Z line. It moves up above. It moves above because the cells of hair, these cells, that these cells were also converting into columnar epithelium. So the Z line moves. Let me tell you another thing that what is actually Z line? That what is actually Z line? Let's talk about Z line. Actually, Z line, or you can say zigzag line. Or you can say zigzag line. So it is the squamocolumnar junction, and it is present where it is present. It is present lower 2 centimeter. It is lower 2 centimeter of esophagus, esophagus, or lower 2 centimeter of esophagus is lined by columnar epithelium. All right, which is and what is that line? I told you. Actually, this is the area which is very prone to metaplasia, or you can say dysplasia, which will ultimately leads to cancer. So if you did not treat your patient correctly, or you can say early detection, that your patient can get what, that is cancer. So what doesn't what does happens in Barrett esophagus? So in Barrett's esophagus, this Z line moves 5 centimeter above JEJ. This is gastroesophageal junction. It moves above the J. So this is called the Barrett's esophagus. Now, very much important thing actually in exam. First of all, that the Barrett's esophagus, which type of metaplasia it will be called? That it will be called gastric metaplasia, or you can say intestinal metaplasia. Actually, it is a very confusing one to answer because in some books, gastric metaplasia is answered, and in some books, intestinal metaplasia is answered. So, but in most of the books, intestinal metaplasia is answered. So, answer this. So, the if anyone asks that the Barrett's esophagus is diagnosed by which one, you answer it as intestinal metaplasia. So, this was the today's topic, the epithelial tissue, and it covered all the topics in epithelial. I told you about stratified squamous epithelium, what is the difference between these epitheliums, and lastly, I also told you about the disease, a very dangerous one, that is Barrett's esophagus, which can, cancer can cause. So this was today's topic.